This video looks at the effects of tandem walking while wearing strobe eyewear. Trial 1 is no eyewear while walking, immediately followed by Trial 2 with the strobe eyewear at the level 5 setting, and finally Trial 3 is a retest of Trial 1. Right away we can see the difference with his balance between Trial 1 and Trial 2. He has more body movement in the frontal plane while wearing the strobe eyewear, resulting in decreased step frequency or turnover rate. Trial 1 was 4.5 seconds faster than Trial 2. The difference between Trial 1 and Trial 3 is his turnover rate. The increased turnover rate produces a faster gait speed for Trial 3. Trial 3 was 0.7 seconds faster than Trial 1. For the next condition, he tandem walked backward. Once again, there is more frontal plane movement and decreased step frequency when wearing strobe eyewear. Trial 1 was 3 seconds faster than Trial 2. The same difference in increased turnover rate is present with the backward tandem walking condition between Trial 1 and Trial 3 as observed with the forward walking condition. Trial 3 was almost 1 second faster than Trial 1. These three trials were videoed in succession with no more than 10 seconds rest between trials. The forward condition involved 11 steps and backward was 9 steps. The improvements are very relevant to ACL reconstruction and meniscus repair patients who are looking to safely improve their dynamic knee stability and proprioception. To maximize improvements, you have to go beyond your regular treatment approach.